Question 1. A nurse observes sawtooth flutter waves at a rate of 300 bpm and a ventricular rate of 75 bpm. What rhythm is this? A. Atrial flutter with 2:1 block. B. Sinus tachycardia. C. Ventricular fibrillation. D. Atrial flutter with 4:1 block. Answer: D. Atrial flutter with 4:1 block. Question 2. A new nurse asks what identifies ventricular escape rhythm on ECG. How should the RN respond? A. Narrow QRS, rate 40 to 60 bpm. B. Wide QRS, rate 20 to 40 bpm. C. P waves without QRS. D. Irregular rhythm with inverted T waves. Answer: B. Wide QRS, rate 20 to 40 bpm. Question 3. A patient's ECG shows frequent multifocal PVCs. What is the nurse's priority? A. Document and continue monitoring. B. Notify provider and check electrolytes. C. Defibrillate immediately. D. Administer atropine. Answer: B. Notify provider and check electrolytes. Question 4. The nurse observes atrial fibrillation on the monitor. What would be expected on physical exam? A. Bounding peripheral pulses. B. Regular radial pulse. C. Irregular pulse. D. Pulsus paradoxus. Answer: C. Irregular pulse. Question 5. Which of the following rhythms requires immediate synchronized cardioversion? A. Stable atrial flutter. B. Sinus tachycardia. C. Unstable supraventricular tachycardia. D. Frequent PVCs. Answer: C. Unstable supraventricular tachycardia. Question 6. What is the most accurate method to determine heart rate on a regular rhythm ECG? A. Count large boxes between our waves and divide into 300. B. Count P waves in 10 seconds. C. Multiply QRS by 4. D. Estimate visually. Answer: A. Count large boxes between our waves and divide into 300. Question 7. A patient with bradycardia is diaphoretic and dizzy. What should the nurse prepare to do first? A. Defibrillate. B. Administer adenosine. C. Administer atropine. D. Observe for 15 minutes. Answer: C. Administer atropine. Question 8. What rhythm is defined by varying PR intervals and no pattern to PQRS relationship? A. Mobitz type 1. B. Mobitz type 2. C. Complete heart block. D. Sinus arrhythmia. Answer: C. Complete heart block. Question 9. A nurse notices fusion beats during a ventricular rhythm strip. What does this indicate? A. Atrial escape rhythm. B. Pacemaker malfunction. C. Junctional tachycardia. D. Interaction between supraventricular and ventricular foci. Answer: D. Interaction between supraventricular and ventricular foci. Question 10. A patient shows sinus tachycardia after hemorrhage. What is the priority nursing action? A. Administer beta blockers. B. Call a code. C. Replace fluid volume. D. Apply ice packs. Answer: C. Replace fluid volume. Question 11. What does electrical alternans on ECG most often indicate? A. Pulmonary embolism. B. Pericardial tamponade. C. Myocardial infarction. D. Hyperkalemia. Answer: B. Pericardial tamponade. Question 12. What is the correct interpretation of a rhythm with a consistent PR interval and slow HR of 45 bpm? A. Sinus bradycardia. B. First-degree AV block. C. Junctional bradycardia. D. Ventricular escape rhythm. Answer: B. First-degree AV block. Question 13. A nurse reviews a rhythm strip showing grouped beats. with gradually lengthening PR intervals. What is this? A. Second-degree type, 1 block. B. Second-degree type, 2 block. C. Third-degree block. D. Sinus arrest. Answer. A. Second-degree type, 1 block. Question 14. A patient with rapid A-Fib reports chest pain. BP is 82/48 mmHg. What's the nurse's priority? A. Administer digoxin. B. Perform synchronized cardioversion. C. Recheck BP in 5 minutes. D. Give oral metoprolol. Answer. B. Perform synchronized cardioversion. Question 15. What describes a rhythm with consistent RR intervals, absent P waves, and narrow QRS? A. Ventricular tachycardia. B. Junctional rhythm. C. Atrial fibrillation. D. Sinus tachycardia. Answer. B. Junctional rhythm. Question 16. What should the nurse do if the telemetry alarm shows V-Tach, but the patient is awake and alert? A. Silence the alarm and monitor. B. Check leads and assess the patient. C. Call a code immediately. D. Begin CPR. Answer. B. Check leads and assess the patient. Question 17. Which rhythm is most often treated with magnesium sulfate rather than antiarrhythmics? A. Monomorphic VT. B. Torsades de pointes. C. Supraventricular tachycardia. D. Atrial fibrillation. Answer. B. Torsades de pointes. Question 18. A nurse notes irregular rhythm, narrow QRS, and visible fibrillatory waves. What is the rhythm? A. Atrial fibrillation. B. Atrial flutter. C. Multifocal atrial tachycardia. D. Sinus arrhythmia. Answer. A. Atrial fibrillation. Question 19. What lab value must be assessed before giving amiodarone for ventricular arrhythmia? A. Hemoglobin. B. Magnesium. C. Potassium. D. INR. Answer. C. Potassium. Question 20. A patient in V-Fib has just been defibrillated. What should the nurse do next? A. Administer atropine. B. Check carotid pulse. C. Resumate chest compressions. D. Intubate immediately. Answer. C. Resumate chest compressions. Question 21. A patient's ECG shows a regularly irregular rhythm with group beating. What is the most likely rhythm? A. First-degree AV block. B. Atrial flutter. C. Second-degree AV block type 1. D. Junctional escape rhythm. Answer. C. Second-degree AV block type 1. Question 22. Which medication is contraindicated in patients with Wolff-Parkinson-White syndrome and atrial fibrillation? A. Amiodarone. B. Digoxin. C. Procainamide. D. Lidocaine. Answer. B. Digoxin. Question 23. What rhythm is characterized by regular rhythm, no P waves, and rate between 40 to 60 BPM? A. Sinus bradycardia. B. Junctional rhythm. C. Ventricular escape rhythm. D. Atrial fibrillation. Answer. B. Junctional rhythm. Question 24. What finding differentiates second-degree AV block type 2 from type 1? A. Progressive PR prolongation. B. Irregularly irregular rhythm. C. Fixed PR intervals with dropped beats. D. Wide QRS complexes with inverted T waves. Answer. C. Fixed PR intervals with dropped beats. Question 25. A nurse is reviewing an ECG with peak T waves and widened QRS. What is the likely cause? A. Hypokalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hyponatremia. Answer. B. Hyperkalemia. Question 26. What is the initial drug of choice for torsades de pointes? A. Atropine. B. Amiodarone. C. Magnesium sulfate. D. Epinephrine. Answer: C. Magnesium sulfate. Question 27. Which rhythm may show P waves marching through the QRS complexes? A. Junctional tachycardia. B. Atrial flutter. C. Complete heart block. D. Sinus arrhythmia. Answer: C. Complete heart block. Question 28. A patient's telemetry shows SVT at 190 BPM. Vagal maneuvers fail. What is the next step? A. Prepare for synchronized cardioversion. B. Administer atropine. C. Begin CPR. D. Give amiodarone. Answer: A. Prepare for synchronized cardioversion. Question 29. A telemetry strip shows polymorphic VT. The patient is unresponsive. What is the priority action? A. Administer lidocaine. B. Perform synchronized cardioversion. C. Defibrillate immediately. D. Check blood pressure. Answer: C. Defibrillate immediately. Question 30. What rhythm is defined by no measurable P waves, chaotic baseline, and irregular RR intervals? A. Ventricular tachycardia. B. Atrial flutter. C. Atrial fibrillation. D. Sinus tachycardia. Answer: C. Atrial fibrillation. Question 31. What is a regular rhythm with wide QRS complexes and a rate of 150 BPM likely indicate? A. Atrial tachycardia. B. Junctional rhythm. C. Ventricular tachycardia. D. Supraventricular tachycardia. Answer: C. Ventricular tachycardia. Question 32. A nurse notes frequent unifocal PVCs in a patient post-MI. What is the most appropriate response? A. Administer digoxin. B. Notify the provider. C. Document and continue to monitor. D. Begin chest compressions. Answer: B. Notify the provider. Question 33. Which rhythm typically requires anticoagulation therapy to reduce stroke risk? A. Atrial fibrillation. B. Ventricular tachycardia. C. Sinus tachycardia. D. Junctional rhythm. Answer: A. Atrial fibrillation. Question 34. What is the nurse's priority after defibrillating a patient in ventricular fibrillation? A. Assess for consciousness. B. Check rhythm. C. Resume chest compressions. D. Call a code blue. Answer: C. Resume chest compressions. Question 35. A nurse sees pacing spikes, but no QRS complexes. What is the best interpretation? A. Normal pacemaker function. B. Failure to sense. C. Failure to capture. D. Failure to pace. Answer: C. Failure to capture. Question 36. What rhythm is most dangerous due to total dissociation between atria and ventricles? A. Atrial flutter. B. First degree block. C. Third degree AV block. D. Mobitz type 1. Answer: C. Third degree AV block. Question 37. A nurse is preparing to give adenosine. What is a key consideration? A. Administer over 5 minutes. B. Give via IM injection. C. Push rapidly followed by saline flush. D. Administer with food. Answer: C. Push rapidly followed by saline flush. Question 38. Which rhythm is characterized by sawtooth-like atrial waves and a ventricular rate of 150 BPM? A. Atrial flutter. B. Atrial fibrillation. C. Sinus tachycardia. D. Multifocal atrial tachycardia. Answer: A. Atrial flutter. Question 39. Which symptom most suggests a patient's bradycardia is clinically significant? A. HR 58 BPM while sleeping. B. Dizziness and syncope. C. HR 59 BPM while watching TV. D. Mild nausea. Answer: B. Dizziness and syncope. Question 40. A nurse observes a long pause between beats on a rhythm strip. What might this represent? APOC. B. PVC. C. Sinus arrest. D. First-degree block. Answer: C. Sinus arrest. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.